I'm David Feng. I'm a Melbourne-trained GP. I've been working in general practice for almost a decade, and in the last couple of years, I've been really interested in medicinal cannabis. And I've been doing this for 2 years now, and we're seeing some really phenomenal patient outcomes. And yeah, that's what spurred me on to founding Canadoc along with Kevin, my business partner, to help patients access this medication if it's right for them. And we're seeing some really, really amazing results, and hope that doing a small step to changing patients' lives for the better. So my goals are, with the company is to promote education, make sure our patients are knowledgeable. I think our patients are some of the most knowledgeable patients in Australia around medicinal cannabis, and we want to keep them up to date and up to speed with all that's happening in this fast-moving industry. And so a part of that, we run these semi-regular webinar series where we offer it to our existing patients and people within our network. And we'll offer usually a Q&A type session, as well as potentially like trends that we're seeing and things like that. So hopefully this webinar will be of good value to you. All right, guys. So I thought I'd spend the first 20 minutes or so giving you a little bit of an update around the medicinal cannabis space. We're seeing a lot of exciting developments coming online. And I thought I'd just share some of those exciting stories that we're coming across. So I'll run through some of those things. There's a patient who wanted me to delve into some evidence around autism and eating disorders as well. So I thought I'd present a couple of papers around those things, and then I'll open it up to the audience for you and answer the Q&A as well. Thanks for all your submissions. We received more than 80 questions to date. Yeah. And although we'll try and get through as many as we can, but I'm just not sure we can do all 80, but Kevin's kindly collated them all into different sections, and we'll try and address as many as we can. Please submit further questions if you have any through the chat box. You should be able to access the chat box through the webinar itself, and we can come to those later as well. Cool, I'll get started. All right, so first point I want to make is that the medicinal cannabis market is actually going very, very strong. We have seen medicinal cannabis, the whole market, grow by about 300% in the last 12 months. And as of end of September, we're estimating there's probably about 25,000 patients in Australia currently using medicinal cannabis. And this number will probably get over 30,000 by the time the end of the year rolls around. And so that would equate to around about $95 million in sales. And this is about 3x that of the sales that were done in 2019. We are seeing about 6,200 approvals done by the TGA as of last month, which is a new record, about 82% higher than the year before. So all in all, patient demand is growing and growing at a steady clip as well. Interestingly, patient dosages have continued to rise over the last 12 months, but the amount of spending they're doing on medicinal cannabis is relatively steady. That tells us that patients are probably confined by price, and that if they can afford to take more, they probably will take more to get better control of their symptoms. If you guys are interested in any of these sort of the facts and figures that I'm presenting, feel free to jump online, look up Fresh Leaf Analytics. They produce a quarterly report, which makes for very interesting reading. You just jump on that website. Going on that point about pricing coming down, we have noticed that there is a pretty dramatic price war going on in the market at the moment. There is a huge number of products on the market, and it's growing fairly exponentially actually. We have 100% more products now than we did a year ago, and there's probably a total of around 150 products on the Australian market. And so this equates to about 37 companies competing for less than 100,000 scripts a year. This is extremely competitive, this market, and compare this to the opiate market. There's only 23 companies competing for 15 million scripts a year. So this is why there's a price war going on. Lots of companies, lots of products, hard to differentiate themselves. And so one of the main constraints on patients using medicinal cannabis is the cost. And that's one of the defining features of medicinal cannabis at the moment. It's still very costly. Patients are still spending, hundreds of dollars a month. And so companies are trying to outcompete each other, and there will be a race to the bottom, which is similar to what's happening in Canada. We're seeing Canadian producers starting to offer really steep discounts to try and win market share for patients, and often these steep discounts tend to kick in when the products are due to expire as well. So we're probably going to start seeing that in Australia as well. So in conclusion, the market is very saturated at the moment. Lots of LPs and more are coming on, licensed producers, more and more are coming online, and more products are coming onto the market. All in all, it's a good thing for consumers. Consumers are spoiled for choice. They will see gradual declines in the cost of their medicines over time. On average, we're probably seeing 20-25% reduction over a 12-month span. My personal feeling is that the trend will continue. Patients will continue to see lower cost products on the market, and all in all, it's a good thing for the consumer. Maybe not so much for the producer. Yeah, it's pushing the market in the right direction. What will end up happening because of this is, there will be probably a rapid consolidation of companies. Some smaller companies will probably face a lot of hard times trying to sell enough product and maintain their profit margins and things like that. So yeah, consolidation is definitely coming. All right, another interesting story that's recently come out is that the TGA has announced that it will aim to down schedule CBD from a Schedule 4, S4 medication to S3. They plan to do this from 1st of June next year. It was a huge announcement because that means it will make over-the-counter CBD available to patients. They have stipulated that these products will have to contain at least 98% CBD, so less than 2% other cannabinoids, and it will only be available for adults 18 years or older, which is a good thing. But one of the downsides to this downscheduling is that they will limit it to about 60 milligrams of CBD use per day. And as a lot of our patients are probably aware, 60 milligrams a day may give them some partial benefit, but it may not be enough to get them full relief of their symptoms. And the TGA has also asked that all these licensed producers demonstrate safety and efficacy over their products before they're allowed to stock it on over-the-counter pharmacist shelves. The main issue with that is, demonstrating safety is one thing. It's fairly easy from a clinical trial perspective, but efficacy is very, very difficult, especially at low doses. So my personal perspective is that they're probably dosing it too low to be able to demonstrate really good efficacy for a lot of these clinical conditions. I'm thinking that a lot of LPs will struggle to get their products on the shelves because of the efficacy claims that they have to provide. So that's one point. And another point that make it harder for patients to access it over the counter is that, just because pharmacies can stock it over the counter, it doesn't necessarily mean the pharmacist will dispense it as well. They may or may not provide a stumbling block to the patients using it. Overall, though, I think it's a net positive for the industry. It'll bring CBD more into the mainstream, into the forefront of people's minds to think about using it. And then if they need to use more than 60 milligrams a day, they can always consult their doctor to access this medication, and which may sort of branch into using something with more THC in it if it's more for, like, say, chronic pain, whereas THC is a stronger pain relief than CBD itself. All right, another interesting news story, the New Zealand referendum is happening this week. New Zealanders will go to the polls and kind of vote whether they want to legalise recreational cannabis. Exciting play for a lot of LPs out there who may want to expose themselves to the New Zealand cannabis market. Could result in a lot of revenue generation for the New Zealand government, and yeah, that could be positive from a taxation perspective. The polls are suggesting it should go either way, potentially with a yes vote to come in just narrowly ahead. This came out maybe about a month ago. The TGA has actually announced, TGA, sorry, I need to put that it's the Therapeutic Goods Administration. They're the people who authorise all medications across Australia. They have to approve all medicines before patients can use it. And they've started to crack down on medicinal cannabis producers. What they recently did was they undertook random testing of products being supplied into Australia, and they tried to match it against what the producers were saying were in the actual bottles. And interestingly, they tested 22 products and 5 of them actually failed to meet the requirements for the contents of active ingredient that was stipulated. 3 products failed to meet the lower limit, so the potency was below that stipulated, while 2 was too potent. And this problem wasn't just seen on the minor companies, it was actually across 4 of the main licensed producers in Australia. Because the TGA hasn't been testing that much, so only 22 products, potentially this issue could be larger than they're actually identifying. I guess what I'm trying to say with the story is that patients need to proceed with caution. I think selecting the right product, selecting the right brand, and making sure that you're actually getting the medication that the bottle's saying you're getting is very, very important. So it's be good to have that discussion with your doctor or whoever's prescribing you the medicinal cannabis. All right, I want to cover a little bit of evidence around autism now. Autism is obviously a fairly serious illness. There is a big spectrum to it, but there are some patients who suffer quite severe symptoms, and anything that can help is often well regarded by families and patients themselves. And I just wanted to present this paper to you by Bakel in 2019. These are researchers in Israel who tried CBD in 53 patients between the ages of 4 and 22 who were suffering from autism. And they actually found that 60% of these patients exhibited lower levels of rage attacks, self-injury, and reduced hyperactivity as well in their symptoms. So that was actually a really good clinical finding. CBD, as most of you are aware, doesn't have psychoactive, is non-euphoric, it doesn't cause a high, but it's very good at reducing anxiety, stress levels, and in this situation reduces a lot of the behavioral issues associated with autism. They also found that sleep problems and anxiety improved in 71% and 47% of children treated, respectively. There was only one downside that they found, and that was that occasionally, about 8.8% of children in this trial showed increased behavioral issues, and 23% showed increased anxiety levels. So basically, in conclusion, this medication may not work for all patients, so good clinical judgment is recommended. I will put a little caveat to that. In the patients that I've seen, anecdotally, I've not seen any patient that has had an increase in their anxiety or an increase in their behavioral issues. Not that I've seen huge amounts of patients, but pretty much every patient that we've tried medicinal cannabis on, to some extent, will get improvement. It may not be the first product that works for them. It may be a switch of a product, trialing something else at a different dose. But my personal hit rate is pretty close to 100% of children that I've seen have benefited from using a CBD type preparation. I hope that it continues, but there's no guarantee. So I'm not sort of obviously not touting it as a miracle medication, but if it helps in some way, I feel like patients, families should try and be aware that there are alternatives to traditional therapies in autism. Okay, I want to address the eating disorder side of things as well. We've got another great question from another patient who wanted me to run through a little bit of the evidence here. First and foremost, as with autism and eating disorders, the evidence is a little bit low. There hasn't been huge, really big randomized control trials out there to examine CBD or THC in eating disorders or autism. So I'm just trying to present you the evidence I've found after a literature search. And there's a paper published in 2011 by Gerard and others that were looking at they wanted to look at the endocannabinoid system in women with anorexia or bulimia versus healthy women. And the way they did that was they looked at the density and function of the CB1 receptors in the brain. The CB1 receptors in the brain are basically responsible or have a role in a lot of homeostatic mechanisms in the brain for control of mood, appetite, sleep, and things like that. And when they did PET scans, which is a sort of fancy CT scan to look at uptake of a specific dye in these women with anorexia, what they found was that there was an increased uptake in the CB1 receptors of women with anorexia nervosa. And the uptake was actually seen all over the brain. In patients with anorexia and bulimia, they also found that the insula, there's a specific part of the brain called the insula that tended to have an increased uptake of the ligand, the substance that they use to detect the endocannabinoid system functionality. And interestingly, the insula is the region that integrates body perception, gustatory information, which means sort of information about the food when you eat it, like taste function, reward, and emotion. This is a quote directly from Dr. Van Laere. They were one of the key authors of this paper. So what they concluded was that, you know, people with anorexia or bulimia, they tended to have deficits of endocannabinoid levels in the brain or reduced CB1 receptor functionality. Essentially, they come to the conclusion that, you know, the endocannabinoid system is very important in appetite control. This leads me on to an actual clinical trial that was run. So the other one was more of a sort of, I guess, a study, an observation about like the receptors itself. The study was actually looking at, you know, giving patients a cannabinoid and seeing how they responded in terms of their eating disorders. So Andrews and others in 2014 did a study on 25 women. These 25 women were being treated for specific eating disorders at a specialized care center. And they did a randomized controlled trial where they gave them dronabinol and placebo, or placebo and dronabinol over a 4-week period. And dronabinol is actually synthetic THC. Okay, it's lab produced. It's sort of hard binding affinity to the CB1 receptors in the brain, and it's very, very similar to THC itself, but just in a you know, purely synthetic lab made way. And so what they found was that when patients were given dronabinol over a 4-week period, they actually gained an average of 0.73 kilos above what they were doing when they were on the placebo. So that's a really interesting finding. It basically means that the synthetic THC can actually stimulate patients' appetite and actually get them to increase their weight above baseline. We did see that the eating disorders index subscoring didn't change at all, meaning it didn't really change their cognitive processing of what was happening in regards to them. How should I put this? You know, their perception of their bodies or their sort of behaviors didn't really change. It really changed I believe the appetite of the patient, and they gained weight because they were eating a little bit more. All in all, dronabinol, the synthetic THC, was well tolerated. There was very minimal side effects, and I don't believe anybody was actually had to be taken off the trial because of side effects. So yeah, synthetic THC can maybe produce a small amounts of weight gain without causing any side effects. There's not been evidence of medicinal cannabis of this in the trial with just medicinal cannabis, so we have to extrapolate what we see here to THC from the cannabis plant. Okay, so that's pretty much all I want to talk about in terms of my presentation. I might move on to the Q&A section if it's okay with you, Kevin.
Yeah, that would be great. Yeah. So I've broken that up into the different categories there, and you should have them.
Thank you, Kevin. Kevin's kindly compiled all the questions that we've received, all 80 something of them, and we've kind of broke it down into different blocks, and I will try and answer these as quickly as possible. I guess I don't want to take too much time. There is a lot of questions to go through, so I'll answer them as best I can, but as quick as I can as well. And then if you've got further questions, if you want me to elaborate on things, please put it in the Q&A in the chat box, and I'll try and come to that later as well. First and foremost, let's address the pain section. Would medicinal cannabis relieve pain caused by psoriatic arthritis in hands? Yes. Short answer is yes. I've seen a lot of patients with psoriatic arthritis. CBD is a fantastic anti-inflammatory, and a lot of patients of mine tend to report that they get reduced inflammation in their hands and in turn reduce pain. But THC is also a fantastic pain reliever. So if you give them something with CBD and THC, it tends to reduce the pain as well as the inflammation. What conditions is medicinal cannabis used for? Is it only for treating pain? No, I would say majority of our patients are using it for chronic pain. I would say that maybe at least 2/3 or 3/4 will use it for chronic pain, but other conditions we're using it to treat anxiety, PTSD, insomnia, nausea and vomiting, and chemotherapy. We use it in palliative care situations. Parkinson's disease, multiple sclerosis, what else? Autism. Yeah, those are probably the most common ones. Pain management for knee pain and arthritis. Yep, works very well. I would say, something with CBD and THC is a very good one to trial for patients with osteoarthritis. Osteoarthritis is more of a degenerative wear and tear type disorder, so there's not huge amounts of inflammation in osteoarthritis. There is a little bit, so CBD may help with that a little bit, but THC does carry some good oomph when it comes to pain relief from that perspective. How long do you have to be on it before you get benefits of chronic pain relief? You don't have to be on it for very long. We always start people on a low dose and then go up from there. You start, the saying in medicinal cannabis is to start low, go slow. Everybody needs a different dose to get the right relief. But once you hit the right dose, then the relief is pretty quick. I would say if you were to take it as an oil, it would start having a benefit within 30 to 90 minutes. If you were to vaporize the flower, you would get relief within 1 to 2 minutes. Okay. Is taking medicinal cannabis effective for nerve pain, neuropathy? Most neuropathic pain patients tend to respond to THC preparation. I have had some patients use CBD and it helps their neuropathic pain as well, but THC is probably a better neuropathic pain medicine than CBD. But the results can be variable. It's a bit of trial and error that takes place before you can figure out if which one works for you. Next is the anxiety, PTSD, and depression side. Required dosages for general well-being, depression, anxiety, and basically how much do I need to take for this purpose. Again, it's patient dependent. Everybody's physiology is different. Everybody's endocannabinoid system or endocannabinoid tone is different. Some have more dramatic requirements. Some have less, and so I've seen patients who've taken tiny doses and gotten amazing results, or I've seen patients take really big doses to get the same result. So I can't tell you. There is no sort of specific, it's never based on weight, height, age, or sex, ethnicity. None of that really plays that much role in it. It really an individualized medication. Okay, what are the benefits of medicinal marijuana regarding anxiety and depression? Anxiety, we tend to see very good benefits from, particularly CBD. I would say, the majority of patients will do really well with, anxiety patients will do really well with CBD or CBD with a small amount of THC in it. Depression, jury's out on that one. If it's a reactive depression, meaning like a secondary to the anxiety, oftentimes people's mood and depression tends to lift if you fix their underlying anxiety or underlying chronic pain as well. So that can benefit from a secondary perspective. If it's just pure depression, I don't know whether the evidence is, which way the evidence leans for that. Medical cannabis for treatment of PTSD, anxiety, depressive symptoms. Yes, we've seen great results in patients with PTSD and anxiety. I have a number of patients who unfortunately have suffered traumas in their life, whether it be through combat, through motor vehicle accidents, through sexual assault, that sort of thing, and not all of them, but I would say the majority of them will tend to respond really well, particularly to a CBD based preparation, not even needing THC. For most of our patients. Similar sort of thing for anxiety. Depression, again, depends on where the depression is coming from. Okay, eating disorder. Would it be helpful to start for eating disorders? I don't have that many patients with eating disorders, so I can't tell you anecdotally how well that works. I've had some patients whose eating disorders symptoms tend to improve on medicinal cannabis, and some who tend to stay much the same on medicinal cannabis. What we do see is that patients with eating disorders tend to have concurrent other comorbidities like anxiety and depression, and they tend to feed on each other. If you're anxious or if you've got OCD and eating problems, then they tend to be a vicious cycle that one feeds into the other and back and forth like that. Once you break that cycle, say you give them some CBD, and my suspicion is if you break the cycle and the anxiety is well controlled, then some of those mechanisms like the eating issues may improve as well. So yeah, from the secondary perspective, it might help. THC might also help by stimulating appetite. So if patients are willing to take it, then you can increase their appetite, and they'll in turn increase their weight as well. But what we do often see is that patients with eating disorders like to feel, well, eating disorders will want control of their behaviors. And I've often seen a lot of patients decline to take anything with THC in it, because if it may make them gain weight, they may feel like their symptoms are getting out of control. So I hope that makes sense. Okay, effects of autism, eating disorder, anxiety, also side effects. I've seen children with autism who've had dramatic improvements, night and day improvements between before and after CBD trial. And I've had parents tell me that their child is more socially adept. They're less afraid of social interactions. They have less rage attacks. They're more settled. They sleep much better. They learn better. I've had parents tell me that they speak better. Like their language improvement is just like this after they've started taking CBD. And that's really heartening for me, because when I look at the literature, it's not that convincing yet. There are there's that trial that I showed you, but outside of that, there's not really great amounts of evidence. So it's about trial and error, but the ones that we do trial on seem to get really dramatic improvements, which is really exciting for all of us at Canada. Side effects. If we're talking just straight CBD for, say, the autism patients, we have almost zero side effects with CBD. Occasionally, some children will complain of some mild diarrhea or sort of mild lethargy for a few days, but they're almost always self-limiting. They go away after a few days, it just disappears and they're back to normal again. So yeah, CBD on its own is very, very well tolerated. THC, we generally don't give to children. I generally don't give to children, because THC has more side effects, which we can go through later. Safety of cannabis for teenagers, good question. CBD is fine, completely fine. THC is the one which may have a little bit of a stigma to it. We know young people under the age of 20 or 25, their brain hasn't fully developed yet, so their frontal lobe function isn't sort of fully developed, and if they were to take high doses of recreational cannabis, we know that and these are far higher than doses we would use medicinally anyway, but young people using high doses of recreational cannabis for an extended period of time, like months at a time, they may increase their risk of unmasking schizophrenia. So they're more likely to be prone to it anyway, but it may unmask it at an earlier age. In terms of side effects for teenagers, it would be similar side effects to adults. So at low doses, you can get a little bit drowsy, you can get dry mouth, dizziness, you can get like a little bit of sedation to it, upset stomach and things like that. At higher doses, you may increase your anxiety levels, you may get palpitations, you may get increased appetite and get munchies, and even higher doses, you may actually, can, at extremely high doses, you can cause severe sedation and very rarely some psychotic symptoms as well. Generally, all these tend to dissipate once you stop it, and medicinal cannabis is like, from a safety perspective, it's actually relatively safe in that there's no lethal dose you can really give to someone. It's actually very, very hard to induce a lethal dose. Actually, it's never been documented before. How does this help anorexia patients? I feel like I've addressed that. Does it assist with the repetitive behaviors like purging and epilepsy or OCD? I've seen a lot of, I'm not so sure about purging behaviors, but I've seen a lot of patients with OCD get improvements with medicinal cannabis, more so from the CBD's perspective. Other medical, can cannabis help Parkinson's disease? Depends on the patient. I know I come back to that quite a lot, but yes, had some patients get really great results. I've had a patient use a very, very low dose CBD and it's completely stopped their Parkinson's tremor. I've had other patients use CBD and THC, at relatively high doses, and it doesn't do very much. So, yeah, each their own, I think. Autism, ADHD, same sort of stuff that I was talking about before. Tends to work really well for autism. ADHD, sometimes you can get some benefits. Again, every patient's different. Different plants meet specific health challenges, such as psychogenic non-epileptic. I'm not sure I understand that question. Kevin, do you know what that question's implying? Do different plants meet specific health challenges, such as psychogenic non-epileptic seizures?
Does a different medical cannabis plant work better for different conditions?
Yeah. So I get asked this question about strains quite a lot when you talk about it in recreational circles. People will talk about, a whole strain, whole bunch of different names, or they'll call it, indica or sativa and things like that. I generally say when we look at the pharmacology of things, in medical circles, we tend to like to talk about the underlying ingredients, underlying active compounds in the plant, rather than what the plant looks like or the nomenclature of like the taxonomy of the plant itself. So rather than call it indica or sativa, we like to say what's the percentage of THC, or it's milligram to mil of THC or CBD in that sort of way. Because all in all, like when you pick up a cannabis plant these days, almost all of them are a hybrid of each other. It's actually very hard to get a pure sativa or a pure indica. And I think it gets very, very confusing if you get a sativa plant that actually has effects similar to an indica plant. So in medical circles, we generally try not to talk about it in different plants, like subspecies and things like that. Okay, efficacy of CBD isolates compared to CBD whole plants. So I think the question is relating to CBD on compound on its own versus CBD plus other minor cannabinoids and maybe a little bit of THC type of, like a full spectrum type product. We know CBD with other cannabinoids in them, plus or minus THC, tend to work better than isolates. But obviously, with full spectrum products, you tend to have a little bit of THC in it, and it probably stops people from driving. So if you absolutely need to drive, then an isolate is fairly good, but it probably won't be anywhere near. It probably won't be quite as good as a full spectrum CBD. Any known allergies to CBD THC? As with anything, like allergies can come along. Anybody can be allergic to anything, really. It's hard to say. I've never seen anybody have a true allergic reaction to the actual active ingredients. I know patients who have intolerances to coconut oil, which is usually what medicinal cannabis comes in now. It's called MCT oil. And sometimes it's made with grapeseed oil and things like that. So if you've got some underlying allergy to the actual seed oils, then could get an allergy. But I've never seen anybody break out in a dramatic allergic reaction. Will medicinal cannabis interfere with other psych meds? The biggest interaction is THC can induce drowsiness, and if you give medications that also can induce drowsiness, like benzodiazepines or opiates, then yes, you can absolutely, you'll have just an additive effect. You just get more drowsy overall. Yeah, it can sometimes interact with anticonvulsant medications. Anti-epileptic medications should be carefully monitored as well, and as well as warfarin or other blood thinning medications. Should probably be best to talk to the doctor about specific interactions if you're going to add a medicinal cannabis compound to them. Okay, what are the long-term outcomes or potential issues of in children who commence medical cannabis treatment? Long-term studies haven't been done, so not sure for now. That's why I tend to steer away from THC, because it's probably more of a theoretical risk than anything. But from my perspective, I don't believe long-term issues will occur with CBD use. There is no evidence to say that long-term CBD use is actually harmful, but nobody knows for 100% certainty, because it's a field of medicine that hasn't been around long enough from a scientific community perspective to have done those longitudinal trials where you're running them over many, many years. Does medicinal cannabis interfere with antidepressants? From a sedation perspective, yeah, if you're on something like mirtazapine, which is quite sedating, then THC may increase the sedation as well. Generally, if you're on like SSRIs, SNRIs, generally most people tolerate it fine. No issue with their interaction there. What are the rough percentage of patients coming off medicinal cannabis, especially when the treated condition has improved? Yeah, unfortunately, patients using medicinal cannabis have almost always got some sort of chronic condition, and if you stop giving the medicinal cannabis, that the symptoms start coming back. You know, if you're using it for chronic pain for osteoarthritis or psoriatic arthritis and you stop taking it, then it's very likely those symptoms come back. We don't tout it as a curative medication, but it's a medication to help manage the symptoms. So yeah, I would say the majority of patients tend to have to use this longer term. Is it helpful for RLS? I presume they mean restless leg syndrome. I've seen a few patients with restless legs using medicinal cannabis, and the majority of these do really, really well. I've seen, I remember 2 or 3 patients who said, almost completely resolved their restless leg syndrome. And then I've seen 1 or 2 who said it didn't really work very well. So yeah, up in the air. Will this help a lot with autoimmune diseases? It can. I've seen a lot of patients with IBD, inflammatory bowel diseases like Crohn's disease, ulcerative colitis, do really well with it. I've also seen patients with psoriatic arthritis or inflammatory arthritis get dramatic improvements in their symptoms and are able to come off some of their other medications like methotrexate or immunotherapy type agents. So yeah, we can see some good results from it. I always say can because it doesn't work for everybody. So I just want to make sure everybody's clear on that. Other patients with IBD showing progress using cannabis? Yes, absolutely. I remember a patient who's in her 30s, had been suffering IBD for many, many years and had tried most things under the sun, on immunotherapies, on DMARDs and all sorts of medications, and hadn't been getting good control of it, needing a lot of surgeries to fix their Crohn's disease. And when we started them on medicinal cannabis, we gave them a combination of oil and flower, one to vaporize for acute pain and one for chronic inflammation. She did phenomenally well. She was able to come off a whole host of medications and finally get her Crohn's symptoms under control with medicinal cannabis. So that's we've seen some good success stories there. Okay, miscellaneous. How to train staff in the administration of the dose. Good question. Similar sort of way as with other medications. You probably need the pharmacist to show you, or the doctor to show you how to use the syringes and the preparations and things like that. If you're in a rest home or aged care facility, or obviously you should probably get a nurse to do the administration. They would have had the appropriate training to do that. But usually it's a medication that's taken orally, so via a syringe. It'd be similar to taking baby Panadol. Like you syringe it up, pop it in a spoon, drink it, or mix it with food, eat it. So training isn't that difficult for the majority of patients. When you start talking about vaporization, yes, that's quite a complex thing to go through, but the person prescribing it to you should walk you through that, maybe give you some reading material of how to use it before you attempt that.
David, I think it's fair to say with that one that sometimes the syringes or the dispensing bottles malfunction. So is there a way to, prevent that happening? Just maybe get extra syringes, or can patients, if they're having trouble with the dispensing seals on a certain bottle of oil, can they get that repackaged by the pharmacist? Or keen to get your thoughts on that one.
Yeah, we're getting a lot of feedback about that actually. Pretty much all the LPs have struggles with getting the right syringe materials. We hear that the ink on the syringes wear off, but from the oil itself, that the oil been quite I don't know what the right term is, but it rubs off the ink markings and you can't see what dose you're taking. Other ones will say the syringe breaks easily. It's happening across the board. I know all the LPs are working really hard to try and get a good product so it doesn't break that easily, but it's not just one manufacturer. Almost all manufacturers are struggling with this. I don't have that much to offer. I mean, you can certainly switch to a glass dropper. You can try and source a glass dropper from a chemist, and count the number of drops that you say you find a steady dose for yourself. You can count the number of drops that you've been taking through a syringe and then extrapolate the number of drops from the dropper. But it's not going to be that as accurate as being able to see a measured dose from a syringe. So that's not perfect a way of doing it, counting the number of drops, because sometimes drop sizes will change depending on the actual equipment. Getting multiple syringes from the pharmacy is probably useful initially, especially when you start. If the ink rubs off, I often tell people to use a sharp knife or pair of scissors and just score the level where they're on that syringe, and that just helps them set a reminder of what the dose is. But that's only once you've reached a stable dose. So there aren't really any quick fixes for that, unfortunately. Hopefully the manufacturers will get their act into gear and give the patients better syringes.
Some good tips though, thanks.
Okay. Working with purchase, and when will the price be more affordable? Price will become more affordable over time. We're going to see continual declines in price, and there's so much fierce competition around. The cost will just continue to go lower, which is great for the consumer. Anticipation of lower costs, yes, definitely. I think all patients should probably go back to the doctor every 3 to 6 months and just ask about any changes to the overall cost of their medications, because you could be on something that may have an equivalent out in the market for a little bit cheaper. What are likely developments around pricing of CBD oil? Extremely expensive, potentially prohibitive unless addressed. Yeah, unfortunately, government hasn't come to the party on subsidies at the moment. So it's reliant on the market trending down. More manufacturers coming online, more competition equals lower prices, and I think that's going to continue from here. How long before it's legalized in Victoria and listed on the PDS? Your guess is as good as mine. I anticipate it might happening over the next few years, hopefully. I'm not, I don't have any connections to Parliament and things like that for them to change legislation, so I don't know really, what movements are being taken to push the PDS. Well, I know there's a lot of lobbying, a lot of pro-cannabis lobby groups out there trying to push this movement. How successful they're going to be, don't know. What sort of referral paperwork is needed, or can clients refer themselves? It depends who you see. Any GP, any specialist should be able to prescribe these sort of medications. It's whether they're comfortable with prescribing or whether they're aware of the ins and outs of these medications and getting the approvals. If you want to come to us, we have a set protocol. We like to get your GP's authority, I guess. We'd like to get a referral from the GP just to say that they're happy for you to use medicinal cannabis. We don't want to step on toes and sort of change management and have GPs be upset with us. So we'd like to get a referral along with a health summary sent our way, and then we can book patients in that way. So we already know what's half the story before the patient comes to us. Okay. Can clients refer themselves? Yes, they can, but we still ultimately like to get some information from your doctor. What does it take to become a medical cannabis grower in Victoria, and can anyone with agricultural experience do it? You need specific licenses, cultivation licenses, and they are actually exceedingly hard to get at the moment. So many people are trying to get grow licenses, and it could probably take you 2 to 3 years before you can get a grow license for if you're starting from scratch now. Coming back to the strands thing, again, like the indica sativa or all the different names of things, medicinal cannabis doesn't deal with it in those sort of terms. Not many manufacturers will deal with it, and most strains will all be a hybrid of an indica or sativa. They only ever quote what the main cannabinoids are, which are THC and CBD concentration, rather than like skunk or kush or whatever. So I can't tell you about what strains they use. Why in Canada? Canada, has biggest production at the moment, and they the biggest companies in the world. Your Canopy Growth, your Kronos, your Tilrays, they all hail from Canada. So they've got the best experience and the underlying infrastructure to get the lowest cost at the moment. How will THC affect my ability to perform daily tasks, including property maintenance? Everybody has different, effects from it. CBD generally won't affect your daily tasks, and in fact, most people say that when they take CBD, they get cognitively enhanced. They feel sharper, their attention's better, the memory's a little bit better, just by a little bit. It's very subtle, but you know, they're all in all a little bit sharper. When they take THC, it's dose dependent. Low doses probably won't have too much impairment in terms of your daily tasks, but at high doses, and it's dose dependent. You know, the higher the more you take, the more likely you are to get maybe some dizziness, drowsiness, cognitive slowing. Some people feel a little bit, you know, what we call dysphoric, like they get maybe a little like a unwelcomed buzz from it. And also, you know, if you get a high enough dose, you can get a bit high. We know THC, you know, can say get you high at these levels, but we know, like, for medicinal purposes, most people take it at about this level. Okay, I've answered that question. I'm with but I'm not sure of service. Think I'm getting played a fool. Done my research, and at the moment, you guys look like the best. Well, thank you. I don't know if we're the best or not, but we try our best. Don't know. Do your research. Make sure the doctor you speak with are, you know, well versed in the field. Yeah, that's all I can say. I mean, do you have anything to add to that, Jim?
Yeah, no.
No. Yeah, I mean, we're doing as best as we can. It's you know, it's a really new field, and so yeah.
Look at the organization's reviews. You know, yeah, just like David said, do some research before you, I guess, pick a provider.
Sorry, guys, a bit of dry mouth. All right, legal. How can I obtain medical cannabis in Australia? It has to be prescription. You have to get it from a doctor. Get it from your GP, your specialist, whoever's willing to prescribe. You can do that. They have to be an authorized prescriber, or they have to go through the TGA application scheme called the SASV scheme. There's a particular steps that you've got to go through to get an approval for that. How can I get medical marijuana for pain? Yeah, same sort of thing. Go to your doctor, speak to them. If they're not comfortable prescribing it, get a second opinion from somewhere else. Speak to a bunch of other doctors if you like. Come to us if you like. Yeah, there's lots of doctors out there prescribing. I would say at a guess, more than 95% of doctors won't have enough knowledge or comfort around medicinal cannabis at the moment to prescribe it. But that's just my gut feel. Yeah, so you may need to explore around to find the right doctor. Who can access this medicine? Pretty much anybody with some form of chronic condition that is not amenable to treatment from traditional sources. Say, if you've got severe anxiety and you've tried a few antidepressants, you've tried CBT, counseling, meditation, exercise, whatever, and it can't manage your symptoms well, then you speak to a doctor and say, look, maybe medicinal cannabis might be right for me, and the doctor will then make an application to the TGA, which is the Therapeutic Goods Administration, and they may say, yep, we think you're a good candidate for using it, and then they'll issue a permit. It's how most people access this. Accessing the medicinal cannabis for cancer or for prostate cancer treatment. I guess, I don't know if that's what the question means, but yes, you can definitely use it for cancer pain. You can use it for, say, if you're undergoing chemotherapy and you can have severe nausea and vomiting and not responding to other traditional anti-nausea, anti-vomiting medication, you can try and access it for that. If it's a really unfortunate situation, like it's a palliative care situation, medicinal cannabis can help as well. Again, speak to the doctor about what indication you're trying to access this for. If you're asking for whether cannabis can be curative of cancer, the answer is right now is no, because we just don't have the evidence for it. We know, like in animal studies, mice studies, that some cannabis may have anti-tumor effects, but you cannot extrapolate that to humans because it just doesn't correlate. So there's no real significant evidence to say that it's curative of any type of cancers. You can certainly help manage the symptoms, but not aim for a cure. How do regional Victorians access medicinal cannabis? through your local doctor, or we have telehealth. We're doing most of our consults through telehealth at the moment because of the COVID lockdown. So yeah, we can certainly arrange a phone or video consultation with patients, and most of our patients appreciate being able to access us through telemedicine rather than coming into clinic. What do you see as implications of proposed rescheduling of CBD to S3? I think I went through that before. Basically, I think it's going to be good for the market overall, but it may not be strong enough to actually have dramatic therapeutic effects at this stage.
Hey, David, just a quick one on that. Will patients, when it does get down scheduled, be able to get from the pharmacist the same, I guess, manufacturer that they've been prescribed in Australia, or do you think it'll be, a whole plethora of manufacturers that they'll have available, even though, like you said, with the different strengths?
I think it's going to be whoever gets their approvals through first. It's going to be a race to get their, because they have to get approval from the ARTG, the Australian Register of Therapeutic Goods. They have to get that listed, and in order to get listed, you have to prove it works well
right.
for certain conditions. And so whoever can get that approval first will get on the shelves first. My suspicion it would be the bigger LPs, because they've got more money to throw behind at the sort of thing to get these clinical trials done. So it might be your Tilray, your Kronos, your Spectrum Therapeutics, and that sort of thing. I think the smaller boys will probably struggle to, boys and girls, struggle to, finance these sort of endeavors. Maybe that's my suspicion. I don't take that with a grain of salt. Okay. When will Victoria approve the regulation like Canberra? Oh. Don't know. Ask the Andrews government. No, I don't have any insider knowledge, unfortunately. Sorry. Can you drive taking medicinal cannabis? Yes and no. If you take only CBD, you can definitely take. You can definitely drive. If there's some THC in the product, I would say no, and it's a pretty hard no, because if it's detectable in your system, then you could potentially lose your license or get demerit points or whatever it is. And it doesn't even necessarily mean that you have to be impaired. It has to just be detectable, because the threshold is actually 0% THC in your body. And depending on how they test it, usually it's a roadside oral swab. That detects active metabolites, and it may be in your system for up to 12 hours or more before after the last dose. But so you may need to stop driving for a certain period. If they do a urine test, it could be 5 days or more. So I generally say, if you're using it for chronic pain or some sort of chronic condition and you've got THC in it, just don't take the risk and don't drive. But if you're using a CBD isolate with no THC in it, absolutely you can drive. How far away are legislations changing regarding driving while reading? Oh, these are such good questions, but difficult ones. I don't know. I have no say in terms of the Parliament and the government to get them to get their act together. I'm hopeful that Australia will follow the Canadian route. The Canadians, after they legislated recreational cannabis, they've sort of put THC into that realm of similar to alcohol. It's more of a, there's a threshold, below you should be okay, or if they're unsure, the cops say they pull you over on the side of the road, they can get a specialist police officer to do a roadside assessment, sort of like a finger nose, walk a straight line type of thing, and see if you're actually impaired at the time of driving. Whereas our laws in Victoria and in Australia are very restrictive. It's anything more than 0% can get you over the line. So yeah, I see the Canadian way to be better personally, but yeah, it is. It's hard to correlate. The reason why the things are like it as it is you can't correlate impairment to the amount of THC detectable in your bloodstream or your saliva or your urine. Some people who use it recreationally use big doses, and so they become tolerant of it, and they don't get impaired, and they can, like, legally they can't drive, but they're unimpaired, so their driving won't actually be affected. But some people who use tiny doses and never been exposed to it before may get dizzy and just drowsy and completely inappropriate to drive from. So that's the biggest concern. How do you measure impairment when the test level doesn't correlate to impairment? It's not like alcohol. Alcohol is almost linear. The more alcohol you take, the more impaired you are. Yeah, I hope that makes sense. Is it legal to drive when on it in the state of Victoria? Yeah, I think we've addressed that. Yeah. Cool. Now I'll move on to the chat box, if that's okay. Do you have any question or any input from you, Kevin?
No, great. Yep. That's. I think we can move over to the chat box. There's the one chat box for direct chat to the panelists, and then also the question and answer section as well.
Oh, there's a two section.
Yeah. Which one do you see? And then if you can't see
the question answer from the first one is from Carl.
Yep. Yeah, we can go through those first.
Okay, cool. Note to David, you have referred to autism as an illness. This is incorrect. It's a neurological condition, not an illness. The term implies illness implies death. Yeah, absolutely. You're right. I think it was a slip of the tongue, unfortunately. Absolutely correct. Yeah, it's not an illness. You're right. It's a condition for sure. I absolutely agree with that. Next question. Next point. I'd like to know more about CBD, THC, and ADHD. Me too. I would like to know more about that, but I just haven't seen that much evidence about it. I probably need to do another literature search on that and get back to you. But for now, for me, that's a little bit of a grey area as to how well that would work for pure ADHD type patients. So I don't have a good answer for you, sorry. I'm interested in ADHD. Yeah, I've seen some children with concurrent autism and ADHD, and they've used the CBD for autism, and I found that a lot of these children's ADHD behaviors tend to improve alongside their autism spectrum disorder. So yeah, it definitely doesn't, like, anecdotally, it feels like these children do better from a behavioral side of things rather than from the hyperactivity or attention deficit perspective. But I generally see that the ADHD symptoms improving as well, not to the extent of as well as the autism symptoms, but yeah, I see it does help. Do you have any findings on cannabis and Parkinson's? Yes, like, again, anecdotal. I've seen patients who've done dramatically well from the movement perspective, particularly the tremors and abnormal gait. So yeah, it does. It can work for certain patients. I can't tell you which patients will work better for though. Tanley, there you said it would be hard to prove the efficacy of CBD oil as the dosage might be too low. In your experience, what would be an ideal dosage for an indication such as anxiety? I would say most of our patients will get some benefit, benefit by 50 to 100 milligrams a day. So yes, that 60 becomes part of that, but when I say some, it means that that's when generally it starts to work. A lot of patients will probably use more than 60 before they get like really good improvements. So it's up to the manufacturer to be able to prove that 60 is an clinically relevant improvement. Okay, so it has to meet certain statistical analysis before you can say that that's definitely effective. Yeah, but so it might just be slightly too low, but around the 100 milligram mark, most people should be getting good results. Take both CBD and THC. However, one of the side effects is that it keeps me up at night. Any possible reasons for this? Yeah, CBD is very cognitively enhancing for some people. For most people, it's kind of like taking. My analogy for CBD is like it's like taking a coffee. Taking some caffeine. You feel sharper, but caffeine often gives people a little bit of anxiety or maybe a bit of a tremor and things like palpitations, that sort of thing. But CBD doesn't. CBD is subtle in that it sharpens you, but it doesn't cause the anxiety, if you know what I mean. It's like the best of both worlds. A lot of people actually get cognitively too sharp from it, so they feel like they're just wired. Not that they're like agitated wired, but they're just so alert that they can't really sleep. And some people don't like that. And so probably the THC in it and during that nighttime dose that's doing that. So how do you fix it? You can reduce the CBD dosage at night and take more THC. THC is sedating, so the more THC you take, the more sedated you will be. How do we manage the tolerance to CBD and THC? I take sodium valproate and notice when I'm taking a break from the THC, the side effects of sodium valproate seem to take over. How do we manage the tolerance to CBD and THC? Okay, CBD, generally, most people don't develop tolerance to. THC, when you mean tolerance, I suspect you're saying that, you know, over time you need to take more and more to get the same result, benefits. I would say probably about 10-15% of our patients will complain of that at some stage. Like if they take a stable dose long enough, they have to go up over time. I normally to get them to stop it for a period, give themselves a drug holiday of about 4 to 7 days, maybe even shorter. That tends to reset your endocannabinoid receptors in the body, and so it becomes you become more sensitive to the medication again. And so when you restart a few days down the track, the medication starts working well again. And I find that's quite useful. And you don't actually, most people like at sort of therapeutic doses, they don't actually get dramatic withdrawal symptoms. If you're taking big doses, yes, I'll wean down slowly, but if you're taking just average doses, you could probably, if you absolutely needed to, just stop it straight away for a few days and then restart. It shouldn't be a problem. You may feel a little bit funny off for a few days, but it's not harmful. Not harmful in the way that coming off opiates and or benzodiazepines could be. Does this medication work on Tourette syndrome? Yes, there's some evidence to suggest it does help Tourette's. I've seen it myself. I've seen patients have dramatic improvements from their motor tics or vocal tics and things like that. Yes. Can CBD help with tinnitus? Pass, don't know. You missed a response to cancer and dementia. Maybe can you maybe retype that question into the question box? I'm not sure what one I missed.
No, I know the one that's being referred to. It was just someone had just typed in cancer and dementia, so it wasn't really an actual question. It was more of a statement. Cancer and dementia. I'm not sure if you are able to talk to that at all.
Okay. Medicinal cannabis, great for cancer pain. I've seen it time and time again where people get severe cancer pain, and medicinal cannabis is really useful for that. It's also really good if you're on chemotherapy and if you've got lots of nausea and vomiting, you can't eat and you're wasting away from a lack of intake, or oftentimes cancer boosts your catabolic rate, so you're actually burning a lot of calories, a lot more than you can take in, and that's why people start to lose weight when they get cancer. Cannabis can help with that as well. It increases your appetite, increases your intake, and you can sort of offset some of those catabolic losses. Dementia, I've had a few patients get a lot of agitation from their dementia, particularly like if it's Alzheimer's or Lewy body dementia and things like that, where there's a lot of cognitive disturbances. Often giving them some CBD or THC or a combination of both actually settles down the anxiety they feel, and it also dampens down their mood, and oftentimes can reduce their behavioral disturbances. Yeah, okay, I've seen that. I've seen improvement in dementia, definitely. Hi, interesting to hear that THC alone can only help with neuropathic pain. I started with CBD only, which should not help but keep me up at night. I have the neuropathic pain and need to take it at night. I'm now on CBD and THC. One-to-one pain is better, but still keeping it at night. Maybe I should just take THC. I think it's worthwhile try, or just take a THC with less CBD. I don't know. I wouldn't say only THC can help with neuropathic pain. I have seen people with who take CBD that help with neuropathic pain, but it sounds like in your situation that CBD isn't helping you with neuropathic pain and keeping you up at night. So maybe worthwhile just taking the a high THC concentration at night. Tash Nichols, will we see the discounted Canadian cannabis in Australia? And if so, how long, for how long till we see the discounts? It's already happening. A lot of LPs are already cutting their prices. Most of our product in Australia is Canadian. And they are all slashing their prices across the board. Yeah, it's happening already. David, for your CNCP, chronic non-cancer pain patient, is that what you mean? Patient with CBD or THC, are they open to recommends physio exercise with your laws on? Yeah, I think that's a really good point. You know, like medicinal cannabis is just an adjunct to traditional therapies. You know, it doesn't. If you've got chronic pain, and you've got arthritis and things like that, then continuing your physio and exercise physiology is actually a really good thing to keep your movement up and optimize your muscle strength and mobility and stuff like that. So never a bad thing to continue on with that. And we generally recommend that patients just don't focus this as the end all be all and end all for your symptoms. It's a holistic approach. Yes, medicinal cannabis will help with a lot of your pain and inflammation, but you should still be doing all those other things that you're doing, like this exercise physiology, or if you've got sort of mental health illnesses, you should still be seeing a psychologist as well as reviewing regularly with your GP or psychiatrist, that sort of thing. So yeah, it's a holistic approach. Is it fair to suggest that intrinsically attracts clientele with higher interest for passive therapies only, including with a lot of barriers for behavioral change and lifestyle issues? I haven't seen that personally, because we make sure that our patients who use medicinal cannabis have tried all the traditional therapies first. Not all of them. I mean, like just tried most of the traditional therapies first before they embark on this route, because the TGA wants that as well. They don't want someone with anxiety never to have done cognitive behavioral therapies or exercise or taken an antidepressant to try medicinal cannabis first line. Never going to happen. It will happen. Never going to happen right now. We'll want to do it by what the guidance from TGA tells us, and we tend to say, look, you try the traditional things first. If they don't work, then we can have a discussion about that, about medicinal cannabis. Tash Nichols, not a question. Fiona Patton is pushing through. Oh, great. Fiona Patton is pushing through a law now that will exempt medicinal cannabis users from the driver's test.
Right.
Great. That'd be awesome. Thank you for that. Can cannabis CBD slow progression? I'm not sure. Progression of what? Fiora Cheshari, can you please just define what you mean? Slow progression of which thing we're talking about? Given if cost is not an issue, is there a potential significant role for liver enzyme profiling with pharmacogenetic services like MyDNA to minimize the need for test and adjust trial error with the? Yeah, good question. I think that's going to be the, I guess like layer one is just trial and error. And I think a layer two, when we become more sophisticated with medicinal cannabis, we're going to be able to figure out what cannabinoids work best for you, how it works how it gets processed in your body by doing these MyDNA tests, and what sort of dosing is appropriate for you, and what other sort of minor cannabinoids can we add in there to get the maximal benefits. But yeah, I think it's coming. Gabby, touch base with reception prior to running out of medication. Finish one bottle open. Right, okay, so Gabby's telling, Gabby is our lovely receptionist. I think she's trying to get me to remind patients that if you're, coming close to finishing your medication, please tell us well in advance. And maybe I don't say this enough, but we would prefer patients to tell us, at least 10 to 14 days before you run out, because sometimes there's supply issues. Sometimes the chemist may not be able to get it for you straight away. So yeah, just give us plenty of time. Oh, Parkinson's. Can cannabis CBD slow progression of Parkinson's? I'm not sure. I mean, there's no evidence to say it will. It helps with the symptoms for some people, but yeah, I don't think there's enough clinical evidence that's being done at the moment about Parkinson's just to show that definitively show progression. So no. Okay, that is an hour 20. Kevin, did you say there were other questions to be taken?
There was a few more I think we could cover that came through in the chat box. Can medicinal cannabis cause an increase in anxiety?
CBD it can't, THC potentially. THC at low doses, we call THC one of these biphasic medications, you know, at low doses it may improve your anxiety, but at high doses may actually increase it. So, you know, just be aware that if you're using something with THC and you've got anxiety, don't push it too hard because you may actually flip it the other way. So yes, it can.
Can CBD be helpful for dry eyes?
I don't know, never tried. Yeah. Thank you everybody for your time. I hope that's been useful for everybody. Feel free to email us if you've got other questions. But yeah, I wish you all a good day.